Today I want to talk about minor health, specifically dust and particulates. And I want to start with something that may sound a little bit backwards. The dust you can see isn't always the dust that you should be most worried about. And we've all been there. Somebody starts drilling and a loader comes through, a truck dumps a load somewhere. We start scaling, the crusher's running somewhere off in the distance. Or somebody starts cleaning up and suddenly there's dust everywhere. You can see it, you can taste it. Sometimes shoot, you can't even see through it, right? Or barely see through it. Everybody recognizes that as a dusty condition, but eventually that dust is going to settle and the air is going to start looking clear again. And it's easy to think, hey, we're good, but we may not be. Because some of the particles that do some of the most damage are so small that we can't see them. Those are the particles that I want to talk about today. Now, before we go any further, I want you all to kind of ask yourself one question here. Where do we see dust being generated on the job? And it could be in many different places. Is it drilling, bolting, mucking, crushing, screening, dumping, haul roads, scaling, shotcrete, or, it could be conveyor transfer points, right? Or somebody just cleaning up. The point is, it's everywhere. You see it all the time. So I want to get this point through is that dust isn't some unusual condition that only shows up once in a while. We generate it during normal mining work. So by the time we're finished today, you're going to be able to do 4 things. We're going to recognize where your exposure is coming from. We're going to understand why respirable dust matters. We're going to identify practical controls that we can use to help, and what to do when those controls aren't working. So what are we actually breathing? Let's start with the basics here. Dust comes in different sizes. Some particles are large enough that we can see them. Some get caught in our nose and upper airway. But some particles are much, much smaller. And those smaller particles can get past many of your natural defenses in your body. And they travel real deep into your lungs. And they reach areas where oxygen gets transferred into your bloodstream. Those are respirable particles. And that's why particle size matters. The fact that you can't see dust hanging in the air doesn't mean there isn't something in your breathing zone. One of the biggest concerns in mining is respirable crystalline silica. Silica occurs naturally in many types of rock, sand, gravel, and ore. So when we cut it, when we drill it, when we crush it, blast it, scale it, or otherwise just mess with it or disturb it, we can create very small airborne particles. Depending on the material we're working, some of those particles may contain crystalline silica. And silica isn't the only particulate exposure miners may deal with. Depending on the mine and the work being performed, we may also be dealing with some other mineral dust. Coal dust, diesel particulates, welding fumes, shotcrete or cement dust, or some other airborne contaminant. The important thing is understanding that what we breathe is part of the hazard assessment. Why does it matter? So here's what makes occupational health hazards different from many of the safety hazards that we're used to talking about. So if somebody gets caught between 2 pieces of equipment, we know immediately that something happened. If somebody falls, we know. If there's an electrical contact, we know. Dust exposure usually doesn't work that way. You can breathe something today, finish your shift, go home, feel fine. You're gonna come back in tomorrow and do it again. The damage may happen slowly. Exposure after exposure after exposure, shift after shift, year after year. And that's what makes it very, very easy to ignore. Respirable crystalline silica can damage lung tissue. One of the diseases associated with silica exposure is silicosis. Silicosis can cause scarring in the lungs, and once that lung tissue is scarred, you don't simply get that lung capacity back. Long-term exposure to respirable crystalline silica is also associated with serious illness, including chronic respiratory disease, lung cancer, and kidney disease. And many of these illnesses can take years to develop. And that's the message I really want people to understand. Something doesn't have to hurt you today to be serious hazard tomorrow. We spend a lot of time thinking about injuries that can happen in the next 5 minutes. Ground conditions, mobile equipment, explosives, electrical stuff, right? You got so many, stored energy falls. And we absolutely should think about those. But minor health matters too, because the goal isn't to just get everybody through today's shift. The goal is for people to still be healthy enough to enjoy their life after mining is over. Okay? So why do we sample? This is also why dust sampling and health measurements matter. You cannot accurately determine respirable dust exposure just by looking at the air. You can't stand there and say, looks pretty clear to me, and know what the miner is actually breathing. Exposure has to be evaluated. And that's why you may see miners wearing sampling pumps or other monitoring equipment throughout your mining career. And if you're the person being sampled, work normally. Don't move the sampler. Don't cover it. Don't tip it upside down, right? Don't intentionally avoid a dusty part of the job because you're wearing it. You need that sample to represent what you're actually exposed to while doing the work. Because the point isn't to get a pretty number. The point is to get useful information so we can protect people. Minor health training under Part 48 includes understanding why dust and other health measurements are taken and understanding these controls used to protect miners. There have also been recent regulatory changes and litigation involving MSHA's silica requirements. For training purposes, you need to verify that before you teach this, okay? The 50-25 rule, I think we're at 100. We are at 100 right now, and it's on the back burner right now, and it's going to be 50 and 25. 25 is going to be your action level, and 50, I think, micrograms is going to be your 8 hour. So you want to measure the exposure. You want to understand the exposure, and you want to control the exposure. You don't want to let abnormal dust become something we simply accept as part of the job, right? And the trick is to control the dust before it reaches miners, reaches workers. Now let's talk about those controls, because recognizing dust doesn't do as much good as if we do something about it, right? And that's important. Our first answer should not automatically be put a respirator on, right? A respirator is PPE, and PPE should be the last line of defense when the other controls are not possible. Respirators are important, but whenever possible, we want to control the hazard before it reaches the miner's face or worker's face, right, in OSHA. So start at the source. Ask yourself, can I stop this material from becoming airborne in the first place? One of the most common controls is water, wet drilling, water sprays, wet cutting, watering haul roads, wetting material before we even disturb it, making sure spray nozzles aren't plugged, making sure we've got adequate water pressure, and making sure the water system is actually functioning, right? Because having a water system installed isn't the same thing as having a water system that's working, right? Next, can we capture the dust? There's dust collectors, vacuum systems, local exhaust, collection systems on drills, controls around crushers and transfer points. The closer we capture the dust to where it's created, the less opportunity it has to get to someone's breathing zone. Right there, right at the bottom, wherever we're doing it. And let's think about ventilation next, especially underground. Where is the fresh air coming from? All right. Where is the contaminated air going? And maybe more importantly, where are you standing? If the ventilation is supposed to carry contaminated air away, don't put yourself directly in the path of that contaminated air. Position matters. Airflow matters. Ventilation quantity matters. And if something changed in the ventilation system, the exposure may have changed too. Let's talk a little bit about enclosed cabs. Now think about mobile equipment. An enclosed, properly maintained cab can be very effective for dust control, but only if we use it correctly. Doors closed, windows closed, filters maintained. Door seals need to be intact. Pressurization working if the equipment is designed for it. Heating and air conditioning systems need to be functioning. The cab needs to be kept clean, right? If you got a dirty cab and it's got dust in it, what the hell are you doing? So if you're operating in a dusty area and you open the window because the air conditioner isn't working, you just bypassed one of the controls protecting you. And that should tell us something. The answer isn't just deal with it. The answer is fix the control, right? Housekeeping can create another exposure. And this happens a lot. Cleanup is another area where we can create exposure without realizing it. Dust settles, and then somebody takes a broom or compressed air and puts it right back into the atmosphere. And we've just created another exposure. So we need to think about how we're cleaning. Can we vacuum it? Can we wet it? Can we use methods that keep the material from becoming airborne? Be especially careful around crushers, conveyors, transfer points, shops, equipment cabs get dust in them. Go figure. And anywhere dust accumulates. Don't create a second exposure while you're trying to clean up the first one. So where does PPE fit in all this? And let's talk a little bit about respiratory protection. Sometimes respiratory protection is required, and when it is, it needs to be the right respirator for the hazard, not whatever happens to be sitting in the box, not whatever somebody had left over from another job. The correct respiratory protection has to be selected for the exposure. And there's more to wearing a respirator than simply just putting it on your face. Fit testing matters, training matters, inspection matters, cleaning matters, right? You're going to have to maintain it. You're going to have to be able to store it. And with a tight-fitting respirator, the seal matters. Anything interfering with that sealing can reduce the protection you're getting. Beards. That's why respirator requirements have to be taken pretty seriously. But remember, a respirator doesn't remove the hazard from the workplace. That only protects. It's the last line of defense. It puts a barrier between the miner and the hazard. And that's why we still want water working. We still want ventilation working, the dust collector working, and we want those other controls definitely working. PPE does not make failed engineering controls acceptable. So let's put this into a real situation here. Let's work through one. You walk up on a drill set up underground. Dust is hanging in the heading. The water coming in the drill looks pretty weak. The collector doesn't quite sound right. And somebody tells you, it'll clear out, just keep going. What do you think you would see here? You'd see a buildup of dust, right? And now we have an airborne dust exposure. Possibly respirable silica, depending on the material. We've got dust inside of our breathing zone, and we may also have a ventilation problem. So what's the next question? What should we check? Well, we should be checking things like water pressure, water flow, nozzles, collectors, filters, ventilation, the air direction, miner positioning, any required respiratory protection. Now here's the important question. Do we keep drilling while we figure that out? No. If the control that's supposed to protect the miner isn't functioning, the answer isn't to work through it until somebody gets around to fixing it. Correct the control. Stop and correct. If you can't correct it yourself, you need to escalate it. Get supervision involved. Follow the site's procedures. But don't normalize working in a failed controlled condition simply because production is just waiting, right? If the dust control isn't working, the job isn't ready. What should you be watching for? This is where the training has to turn into behavior. Before the task, look at the controls. During the task, watch what's actually happening. And after the task, think about cleanup and any secondary exposure you're creating. Ask yourself, is there more dust than normal? Did the material change? Did the geology change? Did the ventilation change? Water pressure, did it drop? Is that nozzle plugged? Is the collector failing? Is the filter dirty? Is the haul road drying out? Did a dust curtain get moved? Did production increase? Did equipment change? Is someone standing in the wrong place relative to the airflow? Did the cab filter fail? Did somebody open a window? Those are changed conditions. Any changed conditions can mean changed exposure. Don't assume that because the job was acceptable yesterday, it's automatically acceptable today. Look at what is actually happening right in front of you. Pay attention to your health. And pay attention to yourself too. Persistent coughing, shortness of breath, wheezing, difficulty breathing, chest discomfort, unusual fatigue. Those symptoms can have many causes. They do not automatically mean someone has an occupational disease. But persistent respiratory problems should not simply be ignored, especially if you've spent years working around occupational dust. And when you talk to a healthcare provider, tell them what you do. Tell them you've worked around mining dust. Silica, coal dust, diesel particulate, welding fumes, whatever applies. Because your work history is part of your health history. And they need to know. So we got a quick knowledge check. And it's going to be 3 questions. And I'm going to give you the answers here. So what type of particles are we most concerned about reaching deep into the lungs? Respirable particles, right? Number 2, give me one control we should look at before simply relying on a respirator. And there's a bunch of them. Water, ventilation, dust collection, isolation, enclosed cabs, any one of those. Last question. If the dust control that's supposed to protect you isn't working, what do you do? You need to stop long enough for the control to get corrected or escalate it. That's the answer I want you walking away with. If the control's not working, take care of it or escalate it. We spend a lot of time talking about things that can kill you today, and we should. But the things that can hurt somebody 20 years from now deserve our attention too. So when you see dust, don't just think, that's mining. Ask yourself, what's creating it? Why am I breathing it? Are the controls working? Has something changed? And then look at, can we wet it? Can we capture it? Can we ventilate it? Can we isolate the miner from it? And if respiratory protection is required, are we using the right equipment the right way? Remember this, the dust you breathe today may not hurt today. That's what makes it dangerous. Control it at the source, use the controls and PPE required for the task. And if those controls aren't working, stop and get them corrected. Because your lungs have to last a lot longer than your shift. I am Scott Chest. This is Lead the Middle. Thank you.